Good afternoon, everybody. So, we are starting off with the 9th topic in the 10-day webinar series. It's on the rehabilitation of persons with disabilities with COVID-19 in healthcare and community settings. So, as always, we'll start off with the quote of Amartya Sen. Disabled people are not only the most deprived human beings in the developing world, they also are the most neglected. So, with this note, we will start off with our current session. Rehabilitation of persons with disabilities with COVID-19. So we know that we have the RPWD Act, or the Rights of Persons with Disabilities Act 2016, and it is the law of the land now. So this act entails persons with disabilities with certain rights. And in fact, its effective implementation during the current crisis will greatly help in healthcare and rehabilitation in community settings of PwDs with or without COVID. Because it is not because of the absence of any rules per se that the rights of persons with disabilities are not being addressed. There are a lot of provisions in the RPWD Act, which is a very well thought of act, and it has got its own importance. Only we need to implement it. For example, Chapter 1 defines caregiver, discrimination, person with disability, high support needs, public facilities and services, reasonable accommodation, rehabilitation, specified disabilities, etc. Chapter 2 pertains to the rights and entitlements. Chapter 5 pertains to social security, health, rehabilitation and recreation. Chapter 6 deals with special provisions for persons with benchmark disabilities and likewise. For example, in section 24.3.1, it deals with the caregiver incentives. For example, persons with severe disability, the Act envisages specific incentives for them. And Section 8, again, if it worked, would be of high benefit in the current scenario. And even the Disaster Management Act 2005, there are the Section 2, the Section 25, etc. of Disaster Management Act is also specifically being mentioned in the RPWD Act, so that the rights and privileges and the priority of persons with disabilities are protected. So we just, in fact, need to effectively implement the RPWD Act 2016 now, so that the persons with disabilities who, in this current scenario of COVID pandemic, they'll be getting the right priority which they deserve. There is need for rehabilitation worldwide, which is particularly profound in low and medium income countries like India. So this is specifically important, especially for all LAME countries. This unmet need has exacerbated by the pandemic, because many services shutting down to reduce the spread of the virus and lack of human resources. These two specific reasons have adversely affected the well-being of the entire persons with disabilities all across the globe, that too very seriously affecting the PwDs living in the low and medium income countries like India, particularly in places that had sparse service provisions and poor access, like the developing and underdeveloped countries. General rehabilitation services have to be reprioritized to reduce COVID-19 exposure risk while ensuring highest standards of care and safety. These are the basic points mentioned by the ICMR with regard to the rehabilitation of PwDs. For patients who remain very unwell and sedentary for a prolonged period, such as those in ICU, rehabilitation services like the medical rehabilitation service of a physical medicine and rehabilitation specialist may be required. It has been seen that critically ill patients can become physically weakened quickly and quite severely. So there is a link between these two. So critically ill patients, many a time they become physically weak, and that too in a quite severe manner. So in addition to respiratory training for such critically ill patients, other rehabilitation measures have to be provided. It's not just the respiratory training, especially with regard to the corona infection, where the respiratory tract infection is the most commonly associated condition. Patients rehabilitation program. So it's assistance with the most basic activities, such as requiring physical help to even just sit up from for a couple of minutes. So for a patient, especially a person with disability who is chronically ill, And if he is admitted to a hospital in a critical care unit, then the rehabilitation starts from the medical rehabilitation, acute medical care itself. Right, like the respiratory training to physical assistance in maybe just to make the patient in a sitting position for a couple of minutes, like that. Then as the respiratory symptom improve, then the patient may be made off the ventilatory support. Then the functional rehabilitation with inputs from a multidisciplinary team of a physical medicine and rehabilitation specialist, of an OT, of a physiotherapist, maybe at times of a psychologist. So such a team approach or a transdisciplinary approach of the rehabilitation professionals would be required once the person is off ventilator and he is in requirement of functional rehabilitation. So there the role of a multidisciplinary team comes in. And so the goal is to return patients to their previous level of function. This process can take weeks or even months. Sometimes owing to excess stress, PwDs may suffer from depression and may require additional psychiatric consultation. This is also important because even otherwise the normal population themselves are finding it such a testing situation with a lot of uncertainties, stress, anxiety, depression symptoms, PTSD and the like. So the persons with disabilities are more prone to such sort of psychological disturbances, and even a psychiatric consultation would be required. Regular psychological counseling is a routine part of rehabilitation care for long-term ill patients, irrespective of the given pandemic situation. Even otherwise, if it's a chronic illness and a patient is admitted in the ICU with all other gadgets and supports like ventilatory support and all, the possibility for psychological distress is more. So in this given scenario, its importance increases furthermore. So the pandemic continues, then the number of survivors increase, the rehabilitation caseload increases. So the long journey of recovery and rehabilitation is ahead of them. So this is a continuous process which calls in at the beginning when the illness is severe, when the patient is in a ventilator or things like that. Then a medical team is required, and further other assistance, a multidisciplinary approach of a rehabilitation team is required, and that is to be carried for quite some time so that they are back to their previous level of functioning in all domains. Some patients may require assistive products, for example, walkers, start completing more functional tasks as they near discharge. So maybe with the help of a minimal support, once they are getting discharged, they may be able to perform their physiological requirements. For many of these patients, rehabilitation to regain function and independence will continue after discharge from hospital naturally. As I said, it's going to be a continuous process. This requires collaborative support of social, community care and rehabilitation services. And hence, this need to be developed or strengthened, because in many of the developed countries, such system is in situ. It is in proper place and it is functioning effectively. But whereas in LAMI countries like India and even other underdeveloped countries like in the African countries and all, this is rudimentary. So in such situations, definitely we need to have a team approach, and it is going to be a continuous process wherein the persons with disabilities are addressed to the fullest. So appropriate options for medical rehabilitation professionals to care for their patients remotely through telemedicine, telehealth or tele-rehabilitation services is the need of the hour now. As we all know, because of the COVID protection prevention norms, we have to maintain the social distance and all other mandatory requirements. So the tele services comes into play. And typically described, telemedicine is a real-time or a synchronous delivery of clinical healthcare services between a patient and a provider through the use of a telecommunication system, most typically requiring both an audio and visual component. So this is the broad definition of a telemedicine service. So this is the need of the hour now. In the present scenario, access to evaluation, certification, and registration as persons with disabilities under RPWD Act is hampered. This is another major domain, especially for us people in the field of rehabilitation should be aware of. Because as we all know, in our country, or for that matter, any such countries like India, to entitle a person with disability for all the benefits and rights of a person with disability, the basic document is the medical board certificate, disability medical board certificate. And unfortunately, in majority of the states, 30 to 40, up to 50% and above persons with disabilities are not in receipt of a medical board certificate, and this has created hurdles in accessing their rights as PwDs, especially in this corona pandemic scenario. So PwDs are at additional risk of mental health issues and stigma as well. In addition, they incur loss of wages if self-employed or from the unrecognized sector. This further poses a big challenge to PwDs to self-sustain. So we have to devise measures by which the distribution of medical board certificate is continued even now. There should not be any hindrance owing to the corona pandemic scenario, wherein we are not able to provide them with the medical board certificate. So tele-evaluation services should be brought in, and they should be provided with the medical board certificate even now. The process should continue so that we can entitle more and more persons with disabilities to all the rights and privileges under the RPWD Act, which is a mandatory requirement now because of this corona pandemic scenario. All information, so we are coming to the important general action points to ensure continuum of medical and rehabilitation services. All information about COVID-19 services offered and precautions to be taken should be available in simple and local language in accessible formats. Some of the points might be, you will be feeling that it is a repetition, because naturally it's a 10-day webinar series, and we have been discussing each and every topic in detail in the previous sessions. So some ideas might naturally overlap when we are discussing the general action points like this. So you can take it as a revision of what we had discussed in some of the previous sessions. So all information should be given in a simple and local language in an accessible format. Sign language interpreters who work in emergency and health settings should be given the same health and safety precaution as other healthcare workers dealing with COVID-19 that we had discussed earlier. All persons responsible for handling emergency response service should be trained on the rights of persons with disabilities and on risks associated with additional problem for persons having specific impairment. This is one aspect which we all need to take it as our duty of advocacy, because the healthcare professionals should be aware of the rights of persons with disabilities. Then only they will be able to discharge their responsibilities to the fullest, understanding or empathizing with a person with disability. And coming to quarantine, if a person with disability is in quarantine, essential support services, personal assistance, physical and communication accessibility should be ensured. For example, a blind person with intellectual or mental disability are dependent on a caregiver support. So such aspect should be understood, and the healthcare worker should be in a position to admit such requirements. They can do that only when such healthcare workers are aware of the rights of persons with disabilities. Adequate accessible testing facility and access to hospital and means of transport is to be made available for PwDs, separate counters, ambulances. This point we discussed in that specific chapter in further detail. So I'm not going to the details now. Then PwDs may seek assistance for rectification of fault in their assistive devices. Hence, the service provider sector, like repair work for such appliances, may be given some relaxation in movements for services. Maybe e-passes can be issued to them. So such system also should be made part of the essential service delivery system. Only the administrators become aware when they are insightful enough regarding the rights of or the requirements of persons with disabilities. And appropriate safety or sanitization should be emphasizing for appliances, especially wheelchairs, canes, stretchers, which are used in moving in community or hospital. This point also we had discussed in much detail. So the cleanliness or the sanitization of these gadgets or these aids and appliances are also of primordial importance. Caregivers should be allowed to reach PwDs by exempting them from restrictions of lockdown or providing passes in a simplified manner or priority, because the authorities, the administrative authorities should understand that persons with disabilities, especially persons with severe disabilities, are dependent on their caregivers even for their activities or daily living, and such caregivers should definitely be given exemption from the lockdown or other strict measures imposed by the administration to curtail the spread of coronavirus. To ensure continuation of support services of PwDs with minimum human contact due to due publicity needs to be given to ensuring personal protective equipments for caregivers. So the PPE, not just the PPE kit, but the personal protective measures, whatever, including simple hand wash to the PPE kit, everything for the caregivers. That aspect need to be understood thoroughly even by the authorities. PwDs should be given access to essential food, water and medicine. So the access itself should be ensured. To the extent possible, such items should be delivered at their residence or place where they have been quarantined. Again, if no specific thought has been bestowed upon to this point, the administrative authorities will never think of such provisions. So again, this is the advocacy role of the institutions or the professionals in the field of rehabilitation to bring to the notice of the authorities that such things are required. The state or union territories may consider revising specific opening hours in retail provision stores, including supermarkets, for persons with disabilities and older persons, for ensuring easy availability of their daily requirements. This, some of the states are already implementing, including Kerala. So this sort of measures should be thought of by the administrative authorities for the betterment of the persons with disabilities. Peer support networks may be set up to facilitate support during quarantine for persons with disabilities. PwDs should be given priority in treatment. Special care should be taken in respect of children and women with disabilities because they belong to the weaker of the weaker sections, or to an extent we can tell it's a double burden. So older persons with disabilities, children with disabilities, women with disabilities, they should be given a further priority in treatment facilities. Employees with severe disabilities should be exempted from essential services work in both public and private sector during the period. Even now, government has issued orders that persons with disabilities need not be brought to the forefront. Now, the recommendation by the ICMR is that even for essential services, employees with severe disabilities should be exempted at least in this given point of time. Online counseling mechanism should be developed to de-stress PwDs and their families to cope with the quarantine period. This is important, and again, Government of India had mentioned in a previous talk also that the Government of India, DPWD, MSJE is coming up with an extensive effort for a 24/7 mental health helpline service all across India to address the such psychological issues of persons with disabilities and other people. That's a 24/7 helpline number. At state level, we set up exclusively for Divyangjan in line with the effort taken by the central government in this regard. Governments may consider involving organizations of PwDs in preparation and dissemination of information material on COVID-19 for the use of PwDs, because those organizations involved, organizations for PwDs will naturally know the specific requirement of a person with disability, so that they'll be able to come up with further effective information materials in this regard. Implementation of these instructions need to be ensured. For that, again, prima facie, the authorities should be aware of such requirements. So they need to be enlightened regarding the RPWD Act as well as the various requirements of persons with disabilities. Then only they will be able to implement such things. COVID-19 assistance fund should be granted to all PwDs, which should be apart from the disability pension to address the financial requirements. Again, these are the recommendations made by the ICMR guidance document. So it would be a very good thing if the administrative authorities are able to provide some other financial assistance apart from their routine disability assistance, which they are already receiving, like the disability pension or say Ashwasagiranam in Kerala. Mobile apps need to be developed in line of Arogya Setu to address the special needs of persons with disabilities on a platform. So this is another good thought which can be implemented. A comprehensive database of PwDs, healthcare professionals, NGOs, self-help groups need to be spatially mapped. So this spatial mapping of a database of PwDs, the healthcare professionals and NGOs will go a long way in helping the authorities to provide effective service to persons with disabilities. For that, an effective system is to be devised wherein we can map, spatially map the database of PwDs. Many of the LSGDs, local self-government departments, are already having such sort of mapping. They have their database regarding the person with disability, their requirements, it's there. But unified effort in this manner would be very effective in dealing with the issues of persons with disabilities in the corona pandemic scenario. This electronic platform can be used to provide information about all COVID-19 related information as a one-stop solution. So this can function as a one-stop solution for all the requirements of persons with disabilities. New PwDs need to be traced or may be registered in the database by the UDID, because you all know Government of India is in a mammoth initiative to distribute a unique disability ID, the UDID card, to all disabled persons across India. This, just like our Aadhaar card, will be a smart card wherein a person with disability can avail all the rights and privileges of a person with disability using this UDID card. So new persons with disabilities need to be traced and they need to be registered in the UDID database, because we know apart from the 7 disabilities which were there previously in the PWD Act 1995, as of now in the RPWD Act there are 21 disabilities, with a provision to include further disabilities or health conditions if required. So such persons which come under the purview of the newly identified diseases and disabilities should also be included in the list of the persons with disabilities. Then only they will also be able to access the rights and privileges of persons with disabilities. So this issuance of UDID card and issuance of medical board certificate for persons with disabilities, for those including the newly identified disabilities, become very important in this scenario. A door-to-door survey, adhering of course to the health norms. All the preventive measures should be adhered, like using of face mask and sanitizer and all. But using these preventive measures, a door-to-door survey to assess the health of PWDs and need-based services should be provided properly to needy by integrating it with the COVID-19 survey. A lot of COVID-19 related surveys are also happening. So if we are able to integrate this survey along with the survey of the requirements of PWDs, then it will be of a lot of help. Special care and greetings to PWDs on the lines of greetings to senior citizens to instill a sense of worthiness, moral support and booster for their mental health. So there are initiatives to instill moral support and for persons with disability, for older persons. So such initiatives, if it is extrapolated for persons with disabilities as well, then that is of immense value for them. Aggressive information education campaign is to be aggressive information education campaign, that is the IEC, is to be started utilizing print and electronic media to address the issues of social stigma regarding COVID-19. So even now in many parts of the world, even in our country, there are some social stigma associated with COVID-19, at least in some part of the country. And again, a person with disability having a COVID-19 may further stigmatize the person, and this is a reality which we need to understand. So such initiatives, so as to destigmatize these things, is also a need of the hour, and aggressive IEC campaign is to be done in this regard as well. Motivate the care provider to take care of PWDs as the important and inseparable social asset which requires special care and attention, because we all should know that the society is made up of a lot of members. It's not that only the wealthy people or the well-to-do people or the healthy people comprise a society. It has got its own components, and each and every component should be strong. Or otherwise, if you're just to take an example, if you're trying to pull a chain having lot of points in it, and in the weaker sections, whenever the knot is weaker, in those points it will simply rupture. Then we will not be able to pull the chain together. So each and every point in the chain should be strong enough. Then only we will be able to pull that chain together. Similarly, our persons with disabilities and other marginalized sector are of course the weaker sections in society. So they need to be strengthened. Then only society as a whole will be able to push through this crisis phase and to tide over the issues of it. Motivate the care provider to take care of PWDs as the important and inseparable social asset. That's the reason why we should take it up in much priority basis. Salaries of persons, irrespective of working sector, should not be deducted in whatever manner. We know because of the economic constraints, many of the institutions are forced to curtail or to reduce or deduct the salaries and all which they are giving. But at least for persons with disabilities, this should not be done. Post-lockdown, separate hours of examination or special clinics are to be designated for PWD care to minimize the risk of infection in each healthcare center. This can easily be very well implemented if the authorities are having a will and if they understand the requirement of persons with disabilities. Then government committees to monitor the services and requirements of PwDs at each level, a central committee at the state level and zonal committee, then plan to materialize the plan of action in districts and tehsils, involve multi-purpose health workers like ASHA to address village level issues, share informations and video materials with healthcare workers and caregivers. A&M can register problems, refer to next higher center of health or on need basis. If possible, periodic inspection by health service team to assess health of PwDs in the villages. So these are some specific points put forth by the ICMR guidance document with regard to the general action plan to ensure continuum of medical and rehabilitation services to persons with disabilities. And disability is one of the primary health concern of developing countries like India, and majority of India lives in villages. We all know that. So the priority furthermore increases. Here, the availability and access to rehabilitation services is still significantly less. This is something which we all should take it very seriously, because in villages, it's not the situation in an urban place. There are a lot of constraints which is being faced by persons with disabilities in villages, and majority of the persons with disabilities unfortunately lives in the villages only. So comprehending the concept of disability and accepting community-based rehabilitation, or the CBR, as an effective intervention is still a challenge in India. As I said, in many of the developed countries, this CBR model is well implemented and it is very effective. But unfortunately, for countries, LAMI countries like India and other developing and underdeveloped countries, this is still a challenge. This implementation of the CBR in its effective form is still a challenge. Majority of rehabilitation services are provided by hospitals or institutions only. Even now in India, majority of the rehabilitation services are provided by hospitals or center-based institutions only, which means that only few PwDs are getting benefited. The challenge is intensified during the COVID pandemic. So this is something which again the authorities need to bestow their serious attention to, and the CBR activities need to be strengthened in the village level. Problems associated with delivery of rehabilitation services. These are absence of comprehensible and well-established strategy. As I said, even the CBR mode is not well established in our country. Then poor planning, limited efficiency, less prioritization of essential resources such as materials, manpower, and finance. Because we are facing a crisis, we are all going through this crisis, and there is shortage of all these set elements. So this all reflects as the problems with effective delivery of rehabilitation services. And since these people already belong to the marginalized sector, they are never addressed in the mainstream discussions even. There should be a multi-sectoral approach towards resolving the problems associated with disabilities. It should encompass interventions for social integration, vocational programs, educational services, and healthcare facilities. So these are the basic important general action plan put forth in the guidance document by ICMR. Now coming to the specific actions, 5 domains has been described in the ICMR. That those are: one is actions for PwDs and their household. Second is action by government or local self-government departments, authorities, agencies, etc. Third area is for healthcare workers. Fourth is for disability service providers, and the fifth action plan is for the actions for the community. So we will consider each section separately. So first we will deal with the actions of PwDs and their household. So the points are: reduce your potential exposure to COVID-19. Everyone with disability and their household should follow the guidance on basic protection measures during COVID-19 outbreak, which we all know very well, so I am not going into its details. If you have any difficulty following these basic protection measures, example, you are not able to access a hand basin or sink to wash your hands regularly, work with your family, friends and caregivers to identify adaptations. For example, a person who is bedbound, he'll be finding it very difficult even for his ambulation. So in such a situation, or some other person having difficulty in his ambulation, it will be difficult to have a hand wash every time going to the wash basin and using water and soap. In that instance, he can be provided with a hand sanitizer. So it's a simple example which I guess. There are a lot of n number of such scenarios. So you work with the family members, your first degree relatives or your caregivers to come up with practical solutions in such regard. Ensure you have your own sanitizer, towel and personal care items, as I said, and avoid crowded environment to the maximum extent possible and minimize physical contacts with other people. If going out for necessary visits, do so outside of peak time periods. This is important. This can very well be scheduled as per our requirement. So if you are able to schedule the requirement in such a manner that we limit our exposure to the possible or the potential risk, then definitely it will be of much help for the person with disability. Then make purchases online or request assistance from family, friends or caregivers to avoid needing to access crowded environment. So these are all self-explanatory, so I am not explaining each and every point. I'll just read out so that you also grasp what are the points being laid down by the ICMR. Consider gathering urgent items you need such as food, cleaning supplies, medication or medical supplies to reduce the frequency with which you need to access public places. Work from home if possible, especially if you typically work in a busy or crowded environment. These are all very practical tips which can be implemented. Ensure that assistive products, if used, are disinfected frequently. These include wheelchairs, walking canes, walkers, white canes, or any other product that is frequently handled and used in public spaces. So we had dealt in much detail regarding this topic as a separate, I think it was the seventh in the series, that maintenance of assistive devices in COVID-19. If you rely on caregivers, consider increasing the pool of those you can call upon in preparation of one or more becoming unwell or needing to self-isolate. This is important. You should always have a plan B and plan C with you, because we are all going through a crisis phase. We don't know what would be the plight of our caregiver tomorrow, what would be the situation of my close neighbor, maybe my father or mother or brother or sister tomorrow. Maybe he will go in for quarantine or isolation or even treatment. So a person with disability definitely should have his plan B, C and D worked out with him, and in a time of emergency he should be able to access to the plan B or C, etc. If you organize caregivers through an agency or they fail to provide you caregivers due to shortage, talk to family and friends in advance to find what support they can provide you if provide you. Identify relevant organizations in your community that you can access if you need help. Prepare your household for the instance you should contract COVID-19. This is important because there is no other go. We are all exposed to the threat of COVID-19, and as of now, maybe up to 70 to 80% of the community need to contract this COVID-19 for the decline of this pandemic, or else we should be having a very effective vaccine, which we don't know when that will happen. So as of now, we should be prepared for all such contingencies, including that for the instance you should contract COVID-19. So prepare for everything. Otherwise, a person with severe disability is diagnosed of having a coronavirus infection, means then you will find it very difficult to organize all these requirements at the 13th hour. So be prepared. Make sure those in your household, including the friends and family you trust, know of any important information they would need should you become unwell. This may include information about your health insurance, your medication, and the care needs of any of your dependents. Children, maybe you are taking care of some other dependent person. So if so, that you should very well make the other person aware that, see, I am the caregiver for this person. So if I am taken for quarantine or treatment or something, please look after those persons. And also, if you are having some health insurance, the details you should definitely provide. Otherwise, if you are taken for a treatment, then the other people related to you will be finding it difficult to meet the economic needs, whereas you will be having a health insurance only because you couldn't communicate it with the your current people, you couldn't avail it. So such situations should not arise. So all such informations you should provide, the person with disability should provide to one or two of the close one of you, lest you are infected in any given instance. Make sure everybody in your household knows what they should do if you contract COVID-19 or require assistance. Make your family members aware of your doctors and other support you receive so that they can communicate effectively should you become unwell. Know the telephone number of relevant telehealth services and hotlines should you have questions or require non-urgent medical assistance. So these are all preparations which every person with disability, for that matter, not even a person with disability, each one of us, including you and me, should be prepared for any contingency in this given hour of crisis. The mental and physical health of household members and caregivers is to be ensured. This is very important. If anyone in the household is symptomatic of the virus, the person needs to be isolated and instructed to wear a mask and to access testing as soon as possible. So each government has got its own, each state has got its own recommendations depending on the corona scenario at the given moment of time. So adhere to the government instructions regarding isolation or quarantine or testing, the strategy which is being adopted by each state at the given point of time. All surfaces need to be disinfected and everyone in the household needs to be monitored for symptoms. If possible, anyone with an underlying health condition or reduced immunity needs to be moved to a separate location until the completion of isolation period. This is important. So especially those people who belong to the reverse quarantine group, like the elderly people, 65 plus age group or the 10 minus age group, persons with other known comorbid conditions like hypertension, diabetes or other neurological conditions or other immunocompromised situations or persons on treatment for cancer. All such conditions, they are prone for this infection and they should be kept separately to tide over this situation. Undertake targeted measures for people with disability and their support networks. That comprises of financial compensation for families and caregivers who are part of casual and self-employed disability workforce who may need to self-isolate and where coming to work would place people with a disability at greater risk of infection. Adoption of flexible work from home policies along with financial compensation for the technology required to do so. Financial measures commonly within a broader based economic stimulus package that include people with disabilities such as lump sum payments for qualifying individuals, then tax reliefs, subsidization of items and or leniency and allowable deferral of common expenses. So these are all again some guidelines which is being put forth by the ICMR in its guidance document, and the administrative authorities are the ones who have to take a call on this. Provision of a hotline for disability service in multiple formats, example telephone and email, for people with disability to communicate with the government, ask questions and raise concerns. Then a dedicated special opening hours by all private and government service providers for persons with disabilities. As I said, some states are already implementing it, and further effective implementation of these measures should be taken up by the state or the central or the local self-governments in this regard. Again, coming to the actions by the government or LSGDs and other authorities, healthcare center, primary health center, district hospitals need to provide barrier-free environment like ramps, railings, wheelchairs, signboard in braille, audio guidances, etc. Even if a makeshift arrangement is made for CFLTCs, that is the first line treatment center for the COVID, even in such instances, it should be ensured that it is barrier-free. The government or the concerned local authorities should be sensitive enough to ensure that a barrier-free environment is provided for persons with disabilities, even for a temporary or a makeshift CFLTC setup. Provide training to healthcare, ASHA, ANM, PRM, to provide video teleconsultation and rehabilitation services. So they need to be equipped and augmented. Consider short-term financial support for disability services to ensure they remain financially sustainable if they experience a downturn in their operations. Again, the actions which a government or LSGDs or other agencies can take up is prioritize disability caregiver agencies for access to no-cost personal protective equipment, including mask, apron, gloves, and hand sanitizer. Training of healthcare professionals in PHC, clinics, district hospitals in managing people with disability. Ensure that caregivers of people with disability have access to COVID-19 testing alongside other identified priority groups. So those people who are who are enlisted in the priority group for testing and other accessibility, the caregivers of persons with disabilities, at least persons with severe disabilities, their caregivers should be given such a priority, or they should be included in such priority groups. Then coming to actions for healthcare workers specifically, they should ensure COVID-19 healthcare is accessible, affordable and inclusive. These three components are very important. It should be accessible. There should not be any barrier. not just a physical barrier, even attitudinal barrier is very important. Affordable. Governments and the LSGDs or the local administration should have strict policies governing the cost of treatment of the COVID-19. Also, the testing facilities that should be affordable. That again, the government has to take a call on that, and it should be inclusive. For that, there should not be any barriers in this regard. Follow the World Health Organization guidance to health workers during the COVID-19 outbreak. Work to ensure all clinics providing testing and services related to COVID-19 are completely accessible. So this aspect of accessibility is very important. Educate attitudinal barriers such as social stigma against disability and the denial of essential services. So this is important. It's just the tip of the iceberg which we see. This sort of an attitudinal barrier is deeply ingrained in the behavior of the society, at least in those developing and underdeveloped countries. And also the financial barriers such as high cost related to the treatment or accessing the facility. So again, government has to ensure that the cost is limited. And ensure that information about the accessibility of COVID-19 health services is disseminated to people with disability and their caregivers. Deliver information in understandable and diverse formats to suit different needs. That is, do not rely solely on either verbal or written information, because there are a lot of the disabilities spectrum. You have multiple disabilities. So a person with visual impairment may be augmented using the audio aids, whereas a person with hearing impairment needs a visual input. So we cannot just rely upon either a verbal or a written. So all the modalities should be taken into consideration. Adopt ways to communicate that are understandable to people with intellectual, cognitive and psychosocial impairment. So again, the mode of communication to persons with intellectual impairment that requires further attention. So such effective communication modalities encompassing the requirement of intellectually challenged people and children or others belonging to the autism spectrum disorder all need to be well taken into account. Deliver home-based consultations for people with disability, including for their general health needs and where appropriate for COVID-19 related needs. During these visits, ensure that you wear face masks, gloves and aprons as per the guidelines provided by the health department. Use hand sanitizer as soon as one enters the household or on leaving the household. When you are visiting a person with disability, then wash their hands with soap and water before and after a consultation. It's not yours only, theirs also. Physical contact with the concerned person should be minimal whenever possible. So, if teletherapy is possible, do that, and in your house visit, if required, then also try to just limit your physical contact as much as possible. Deliver telehealth for people with disability. Provide telephone consultation, text messaging, and video conferencing for the delivery of healthcare for persons with disability. This may be for their general health and include rehabilitation needs and where appropriate COVID-19 related needs. So as far as possible, be it is general health requirement or rehabilitation therapeutic requirement or COVID-19 specific requirement, try to provide teleconsultations, teletherapy. You can either it can be a telephone or even one-to-one video or chatting using maybe WhatsApp video call or some other. So that sort of teletherapy should be entertained. Visits must be kept minimal when providing rehabilitation services. Family members and caregivers must be trained to deliver the rehabilitation and follow-up to be done over video calls or over telephone. So there should be some sort of a training which is to be given to the family members and caregivers so that they can effectively implement this modalities to the fullest. There must be provision for handouts, written instructions on how to carry out the intervention to ensure minimal deviations or errors. Healthcare workers must be trained about the potential health and social consequences of COVID-19 for people with disability. How? They must be sanitized to deal with people with disability and understand their concerns. So they need to be made aware, they need to be enlightened on the PwD Act and all other relevant provisions for persons with disabilities. They must be trained to educate people with disability as to what to do in case they contract COVID-19. So this is a huge responsibility for a healthcare worker, and he should understand that this is an added responsibility to him. It's not just Okay, then so healthcare workers must wear PPE, personal protective equipment, and deliver sufficient support for people with disability with more complex needs, particularly if quarantined or isolated. So these protective measures, whatever are the guidelines issued by the state government from time to time, that has to be adhered to. When needed, coordinate care between health officials, doctors, families, and caregivers. This is important. It's not just you attend your client and you just go. It's not like that. You have to coordinate with the family member or the caregiver or the therapist or the doctor as the situation demands, because it's unique. The requirement of each and every PWD is unique. You should cater the requirements of the PWDs. Reassess, then coming to the action for disability service providers. Reassess their caseload of people with disability, identify their current rehabilitation needs, and revise goals if applicable. So now in this corona pandemic scenario, maybe you should revise your goals which has been set previously in the pre-corona era. So now that is important. So as a therapist, as a rehabilitation professional, you will have to rework the goals. You will have to reassess the caseload of the people with disability and identify the current requirements. Then what to do? Discuss with family the need to change the goals and explain how it will be delivered. That is a combination of home visits and tele-video calls whenever possible. So again, you are equipping and empowering the near and dear one of person with disability to take more control or to involve furthermore in the requirements of the person with disability now. This is akin to the parents taking care of the children's educational requirement in this given corona pandemic era. You know that now parents are becoming more aware of the various softwares, maybe Zoom meeting or whatever, Google Meet, so that they are training themselves to operate these things so that they can facilitate their children's education. So the class, all e-classes are, so now the parents are taking more and more responsibility. Similarly, just in case as for their educational requirement, for persons with disabilities also, the first degree relatives or the caregiver need to bestow further attention in this hour of crisis. So discuss with family the need to change the goal and explain how it will be delivered. Then educate the family about new method of service delivery. That is reduced in-person home visits, more of tele-video follow-ups. That's what I told. So in such situations, the family members should be equipped enough to deal with this sort of tele-consultations. Emphasize the need for the family caregiver to take up more responsibility for the rehab needs of persons with disability in the interest of safety and precaution. So you make them aware that I am not coming regularly for the therapy, so that the chance of spread of corona, I am trying to reduce the chance of spread of corona. It's not that I don't care for your for my client, but this is the scenario. Similarly, as I said, just as in the case for our children, we are equipping ourselves more with the online therapy, online mode. Similarly, for the therapy requirements of our near one, the family or the caregiver need to further equip them regarding the tele services. Provide the person with disability and their family with contact numbers of relevant services and agency to get in touch in case of any emergency or medical needs. So this has been discussed previously as well. For example, fixing their assistive aid, repairing hearing aid or glasses, supplies of urine catheters or bag, nearest COVID-19 testing center, nearest pharmacy or hospital number. This is very important because they may not be in a position to inquire and access the information regarding this. But say, for example, a person with severe hearing impairment who has been using hearing aid and his battery is not functioning now. He is rendered helpless at this moment and he becomes simply perplexed and more anxious because he's not able simply to hear. So then immediately, then and there, we'll have to replace his battery. It may be a very silly thing, but you should know from where to replace it. Similarly, urine catheters or Eurobags for those persons, so those bedridden person who want to routinely change his catheter, there should not be any delay. It will lead to severe physical, medical complications even. So such things they should be equipped with. In case of shortage of workforce due to quarantine or COVID-19 positive, plan ahead and build capacity of family members and caregivers to deliver the rehab services for their relative with disability. So as I said, plan B, plan C, etc. should be in position. Prioritize and work with the most critical people who need disability services. So again, you need to prioritize whoever is in more need. You will have to prioritize their requirements. So persons with severe disability, persons with multiple disability, etc., would be demanding further focus and attention. So identify the clients most vulnerable to a reduction in services and communicate frequently with people with disability and their support networks. Provide additional targeted information on COVID-19, highlighting information relevant to people with disability and their support networks, like information on continuity plans, telehealth and hotline phone numbers, locations of accessible health services, and locations where hand sanitizer or sterilizing equipment can be accessed when their supplies are low or in situations where they may be required to self-isolate. So these points all should be kept in mind while dealing with the action plan for disability service providers. Use a variety of communication platforms such as phone calls, text, and social media to share information and convert existing information to accessible formats where necessary. Reduce potential exposure to COVID-19 during provisions of disability services, very important. Provide training and rapidly upskill the disability care workforce regarding infection control. So that is important even for infection control. The training and rapidly upskilling of the workforce is required. Ensure that the disability caregivers and service providers have access to personal protective equipment, including masks, gloves, and hand sanitizers, because in many of the underprivileged or the low socioeconomic strata group, these are all matters of concern. Consider increasing orders of these products as required. Deliver appropriate disability services through home-based consultation or through similar platforms as used in telehealth. Identify the potential for increased violence, abuse, and neglect against people with disability because of social isolation and disruption to the daily routines. This point also we had discussed in detail in a previous previous topics. I had even given the statistical data of the increased number of violence against persons with disabilities, children with disabilities, and all. So this is a very important point. Again, the authorities, the governing authorities, need to bestow their attention upon. Support, then they should support mitigation of these risks. For example, provide an accessible hotline to report such things. Coming to the actions for the community, basic measures to be adopted by the general public. Following the guidance prepared by WHO on basic protection measures against COVID-19, that's important. Take the risk of COVID-19 very seriously. Even though at least some people are taking all these things in a very silly manner, that is not at all acceptable. Even if you yourself may not be at high risk of serious symptoms, you may pass the virus on to someone that is. So this is the key of the thing. Maybe you consider even that we are not sure whether we are fully healthy. Even if you are fully healthy, maybe you may not be affected much, but there is a high chance for you to transmit the disease to some near or dear one who is furthermore vulnerable. So that chance is always there. So take the disease very seriously, adhere to all the precautionary measures. Sorry. Flexible work arrangements and infection control measures to be supported by the employers. Where possible, implement flexible working arrangements that allow people with disability to telework. Ensure they have the technology they need, including any assistive products typically available in the workplace. So we should not insist for their physical presence always in their duty, but equip them with the necessary infrastructural requirements so that they can do their telework more effectively. If telework is not possible, consider allowing a person with disability at high risk of severe symptoms to take leave, including paid leave, until the risk of infection is reduced. So such institutions themselves can take a call on this and act empathetically. Explore government policy and support that may be available to employers to enable the implementation of these measures. Ensure the accessibility of workplace infection control measures such as hand sanitization stations. This is being implemented by majority of the institutions now, government and even private institutions. Consider providing allocated hours for people with disability or other potentially vulnerable people to access the store, or consider alternative ways to allow people with disability to shop. Example, online delivery to home or online services. This we had discussed previously also. Extra support to be provided by family, friends and neighbors of persons with disability. Check in regularly with persons with disability to provide emotional and practical support, respecting social isolation restrictions that may be in place. So this is again, you should understand the specific requirements of persons with disabilities and adhere to that. Be cognizant of how you talk about COVID-19 and do not exacerbate any existing stress. This is very important. Even when you are sharing an information which you think is true, just kindly cross check, because we are flooded with lot of misinformations all around us. So as I had emphasized in the previous sessions as well, just trust those informations which are being forwarded from reliable sources like the WHO or the state or central health ministries only. Do not exacerbate any of the existing stress.